Menstruation usually begins in young girls as they attain the age of puberty. This is usually between age 8 and 17, or 2 years after the first signs of puberty. The first period can be met with either celebration, fear, or concern. For every girl, this signifies an important transition to womanhood, a time when they would benefit from support of family and friends. On the flip side, it also signifies the start of excruciating pain for most young girls, even as they graduate to womanhood. Dysmenorrhea is one of the common gynecological problems amongst all women, regardless of age or race. It is one of the most frequently identified etiology of pelvic pain in females. The prevalence of dysmenorrhea can vary between 16% and 91% in women of reproductive age, with severe pain observed in 2 to 29%. On Healthy Living today, our focus is on dysmenorrhea, and our guest is Dr. Segun Akindokun. Dr. Akindokun is a consultant radiologist with over a decade experience in active practice. He will be shedding more light on dysmenorrhea, focusing on the causes, risk factors, preventive measures, and solutions. Stay tuned. Thank you so much, Dr. Akindokun, for having us today.
Thank you.
All right, this topic, dysmenorrhea, that we're discussing today, a lot of women tend to experience it, but I feel like before we dive deeper, we should just know what it really means. Could you please explain to us what dysmenorrhea means?
Yeah, thank you. Dysmenorrhea simply means severe cramps and pains during menses. People that have pains during menses, that is what we call dysmenorrhea.
Okay, are there causes or risk factors, that can prone one into it?
Yeah, thank you very much. Before I will even talk about the risk factor or causes, I will tell us about the two types.
Oh, there are types.
Yes, they are majorly divided into two types, what we call primary dysmenorrhea and secondary dysmenorrhea.
Okay.
Primary dysmenorrhea simply is the type of dysmenorrhea that occurs from the onset of menses throughout individual lifetime. Throughout.
Wow.
While the secondary dysmenorrhea is dysmenorrhea that happens along the way as individual is maturing. Individual started menstruating, has not been having pain, but suddenly just started having pains during menses. That is the secondary type. So what are the causes?
Yes.
Now, for the primary type, there is no known cause, but the major thing that has been attributed is this, that when we have imbalance in prostaglandin hormones. Prostaglandin is one of the hormones that is in the body of everybody. Okay. But when this hormone is higher than normal, it can make individual to have repeated contraction during menses that will not give symptoms of severe pain.
Sir, before you go ahead, you said contraction.
Yes.
Is it the same as the contraction for women in labor?
Yes, similar to that. Oh. Similar to that. But this time around, the person is not in labor, but just during the menses, the individual is experiencing that. And what are the causes of the secondary type? And the causes of the secondary types are many. And I will start from the common one, whereby the inner layer of the uterus, the inner layer of the womb, is now found outside the womb itself. Wow. The inner layer of the uterus, we call it endometrium. So when we now find this endometrial tissue outside the uterus, then we call it endometriosis. So okay. Endometriosis has been known as a number one causes of secondary dysmenorrhea. Now, okay. Other causes are this. Individual with uterine fibroid, person can have dysmenorrhea. Individual with any pelvic mass, any swelling, any mass in the pelvic region can have dysmenorrhea. Individual with pelvic inflammatory disease, infection, that we have discharges or not having discharges, but having pelvic inflammatory disease, the individual can have dysmenorrhea. And individual that are obese, they can have tendency to have dysmenorrhea. And the individual that has abnormal pregnancy, like ectopic pregnancy before, they can have dysmenorrhea. So these are the few causes of secondary dysmenorrhea. And other people that are used to taking alcohol excessively or more alcohol, they can have dysmenorrhea too. Now, when I'm talking about the risk factor, the risk factor for dysmenorrhea are many, and the risk factor that has been found that the individual that is taking alcohol or smoking, especially around the menstrual period, it can make them to have dysmenorrhea. So taking alcohol or smoking can have individual to have dysmenorrhia. An individual that's fond of taking caffeine and any drinks that contain caffeine, yes, can make individual to have dysmenorrhea. And another thing that can make people to have dysmenorrhea is this, that if individual commences menses before age 11, early menarche. Menarche means the age at which individual notice the first menses.
Oh.
Yes. So individuals that now have the first menses before age of 11, they can have dysmenorrhea.
But I'm surprised because you said individual that, start experiencing their menses before age 11. Because I think this generation now, children from 9 tend to start experiencing their menses. So does it mean that they are prone to having dysmenorrhea?
Exactly. It's one of the risk factors for dysmenorrhea.
So how can it be avoided, basically? For especially children that you don't plan it.
We will still get there. You cannot control the rate of growth of children nowadays. Once they enter puberty, we have early puberty and we have late puberty. So individual that have early puberty, you can't control that.
Exactly. So I'm surprised.
Yes. One of the risk factors is early menarche. Having first menses before age 11. So can make the individual to be at the risk factor of dysmenorrhea.
Okay.
Another thing that is the risk factor is that the individual that didn't get pregnant for a longer period, for instance, maybe individual that is in nulliparous for a longer period. Nulliparous means someone that has never been pregnant before. Or not giving birth. For a longer period, we have some individual that didn't get pregnant at the age of 30-something, 40. So they have tendency, it's one of the risk factors for dysmenorrhea. That is, you didn't get pregnant for a longer period, can have a dysmenorrhea. Then another thing that can be the risk factor is what I've said, people that have a vaginal discharge that's not properly treated, they can have a dysmenorrhea. And also those that have multiple severe fibroid that is not properly taken care of, they can have dysmenorrhea. Then I've said so, obesity, people that sit down for longer periods, sedentary lifestyle can make them to have dysmenorrhea. So those are the risk factors for dysmenorrhea.
Okay, besides, I know a lot of women experience pains in different ways, but besides the pains that they see, is there any other symptoms that they can, use to note that, I think I have dysmenorrhea and at least when to go for a checkup?
Yes, the signs and symptoms for dysmenorrhea are many, and it varies from one person to the other. Now, severe, frequent pain is constant things for everybody that has dysmenorrhea. Severe, frequent cramps or pain during the menses is a constant symptoms for individual. What are the other things? People can be having headache. People can be having nausea. They feel nauseated as if they want to vomit. People can be vomiting. People can have low back pain. They will feel the pain at the lower part of the back. And the pain can even radiate to the legs. People can have that experience. And people can have even diarrhea during this period. You know, think, what happened? People can have that diarrhea. And people can have weakness or tiredness during that period.
Sounding like pregnancy symptoms.
Exactly. And the most unusual signs that somebody can have, that somebody can even faint.
Wow.
Because of severe pain.
Okay, that's true.
People can even faint.
When I was in school, I learned, there's this my friend that whenever it's a time of the month, she'll pass out. They have to rush her to the hospital to give her some injections and bring her back. And I was like, it's crazy. I don't think it could be menstrual pains. There has to be an underlying
she has
ailment.
Familiar spirit,
you know,
or
we
evil
just associated every other thing to it, but not menstrual pain, because we just believe that it couldn't just be.
Yes, people can faint because of the menstrual pain.
Wow.
So those are the things people experience, and then the pain from one person to the other differs. Depends on the risk factor, and also the causes for individual, and also the pain threshold for individual.
Okay.
So some individual, they can bear pains, while some, they cannot bear pains at all. So it varies. But those are the things individual can experience, can have headache, can have vomiting, low back pain, and leg pain, can have nausea, can even faint, can have dizziness, weakness.
I'm just very surprised that about 90% of women actually go through this pain, because you would hardly find one who's not going through it. Because we went to the streets, we asked people, do you go through menstrual pain? And people had a lot to say. But now some persons are associating sugar intake, excessive sugar intake, to dysmenorrhea. How true is this?
It can be a contributing factor, in the sense that one of the preventive things that I'm going to mention later is that during this period, taking a lot of proteinous food helps. Taking a lot of proteinous food. So definitely, if individual is not taking excess sugar of protein, definitely the individual may have that.
Because you just mentioned protein, sorry to cut you.
Okay.
Does it mean that, for instance, if I am having dysmenorrhea, I can just sit down with a bowl of pepper soup and eat a lot of meat, take a lot of milk?
You can take that.
Eggs.
You can take that during that time. During that time, you can take that. Taking a lot of proteins helps to reduce severity of painful menses.
Do you know that this statement you just made now, I had to make a reference to milk, because a few weeks back, somebody asked me in the office. She said, can I take milk? I'm on my period. They said it's not good. You know, there are lots of stories on the streets that you don't take milk while you're on your period. You don't do a lot of things while you're on your period. You don't use shampoo to wash your hair while you're on your period, because your body is open and you're prone to any kind of chemical attacks.
No, it's not true. It's not true. Whether you wash your hair with shampoo or not, has nothing to do with the menstrual pain. And it only has to do with your way of life and also what you are eating. So when I'm going to give what are the preventive measures and what are the treatment, I will still mention this. But it has nothing to do with what you are using to wash your hair, the type of hair you are doing, or if you take milk. But when you take a lot of proteinous food, it helps than carbohydrate food.
Okay, a lot of protein during this period actually helps.
Yes.
Because I know that most women tend to go through it all the time, month in, month out, and it's almost like it's a normal way of life.
I remember when I have a family friend that came, that one day now the menses started and the person almost passed out in the middle of the night. I was wondering, well, wow, how can somebody pass out because of the menstrual pain? So, and I remember that, it's one of the things that the individual can experience, apart from all those symptoms and signs. Fainting during that period is also can happen.
It's just so, I don't know how best to explain it. But then a lot of women also believe that. I deliberately had to bring these beliefs because of what I have heard after going to the street to find out what people think. Some persons believe that when you're on your menstrual, or when you're on your period, the best thing to do is to eat dates. Dates helps you. And a lot of people have also found it as an avenue to abuse lots of drugs. Some people take paracetamol, some take ibuprofen, and they take it in excess. You know, just a few days back, I was talking to a lady. I said, excessive use of paracetamol and overdose can actually shut down your liver. But she was like, it has never happened. I have been taking it. I take up to 10 tablets when I'm in pains.
Yeah, well, that is a drug abuse. And I will now talk about treatment and prevention here. Now, there are a lot of treatments that have been highlighted work for people in the past. Now, we have the medication treatment, whereby it is the use of drug medication. And we have a group of drugs that inhibit prostaglandin I mentioned the other time, prostaglandin inhibitor. And the first group there is what we call a non-steroidal anti-inflammatory drugs. And this one belongs to the group of ibuprofen, diclofenac, aspirin. People can take this and get relief. But they can take it within the normal dosage, not excess. They can get relief that time. And then that is people that didn't have ulcer. But those that have ulcer, they make use of acetaminophen, which is paracetamol. And this one has to be used according to the prescribed dosage. And overdosage of all this has detrimental to their life. And then, like what you said, the excess use of paracetamol can cause liver failure, which people should not abuse. They don't think that paracetamol is just ordinary medication. No, it's like any other medication. So now, other things people can do apart from those medications during the menstrual pain, and they can increase proteinous food by taking more proteinous food that time. They should reduce taking any fluid, any drink that contains caffeine. You know, a lot of that contains
most of
caffeine,
our sugar sweetened beverages,
so
of course.
they should run away from it. Take more proteinous food. If they are smoking, they shouldn't do that. If they are taking alcohol, they shouldn't do that at that time. And apart from that, other things they can do at home, they can make use of a hot water bottle and place on their lower tummy. They can make use of the hot towel and place on the lower part of the tummy, which also helps. They can even have more hot water bath. Hot water bath during that period, it also helps during that time. And another thing they can do that they can involve in activity, exercise during that time, not sitting down in a place. It also helps during that time. Then another thing they need to do, that is the secondary in terms of treatment, is that if they know that, they have fibroid as part of the secondary causes of dysmenorrhea, they need to see their gynecologist and plan how to remove that fibroid so that they can get relief. Another thing people do, that those that have infection, they need to treat infection. And those that have any mass in the pelvic region, they need to see their gynecologist so that it can be removed, so that it can be relief. And for those that have even completed their family, they can even remove inner layer of their womb so that they won't be experiencing that. Or they can even remove the uterus, the whole womb, so that they can be free. So those are the options. So the other option people have experienced that they can take acupuncture, so that during that time the nerves that control pains for that region will be paralyzed, will not work during that period. So they can do that also. So those are the things people can use in treatment. Then what are the preventive things that they need to do? An individual that is fond of doing exercise is a very good relief. Those that engage in exercise, different exercise, yoga, or good relief. People taking balanced diet regularly, it helps. When their period comes, it will reduce the pains. If they have been taking balanced diet that's rich with a lot of nutrients, it also helps. And then people taking a lot of proteinous food, it helps. That reduce the dysmenorrhea. And the other thing people also do is that if you can be taking vitamin supplement, especially vitamin D, it helps in preventing these painful menses. So these are the preventive things people can engage themselves with.
All right. And while you were mentioning the preventive things that it can do, you also mentioned that if a woman has fibroids, she can go and take it out. But how do you even know, while experiencing dysmenorrhea, that, this could also be there could be an underlying cause for this dysmenorrhea? How do you begin to tell so that you know when to go to the hospital?
Well, actually, for every complaint that has to do with dysmenorrhea, you need to go to the hospital so that you can be examined.
Okay.
The doctor can examine you, physical examination, or you can do ultrasound to check that, oh, is it actually fibroid that is there, or there are other things. There can be masses in the ovary or in the pelvic region apart from the fibroid, or there can be also infection going on. So they will do investigation to really know what is going on. But definitely, the person that has primary dysmenorrhea supposed to know herself from this discussion, and the person that has secondary dysmenorrhea is supposed to know. Individual that has not been having painful menses from onset and suddenly started having painful menses, then the individual needs to investigate and know exact cause. Once you know the cause, then it can be treated.
Okay, so these preventive measures you just listed actually also works for both primary dysmenorrhea and secondary dysmenorrhea.
Exactly.
Okay, you mentioned endometriosis earlier. That means they have a relationship.
Yes, so I've said endometriosis is one of the main cause of dysmenorrhea,
Okay.
whereby I explained that you have the inner layer of the uterus is located outside the uterus itself. In a layman language, inner layer of the womb is seen outside the womb.
Okay.
So that is endometriosis.
Okay.
So it is a known cause of dysmenorrhea. That tissue can be found in the ovary, can be found around the ovary or in the peritoneal cavity.
Okay.
And every month you'll be bringing excruciating pain.
So
Yes.
does this dysmenorrhea, endometriosis, do they have anything to do with infertility in any way?
Well, it depends. There is relation between them.
Wow.
It depends on the degree of endometriosis of individual.
Okay.
So individual that the endometriosis is found in both ovaries, so tendency is there that may affect the ovulation. And when the ovulation is not there, the individual may not conceive.
Oh.
And meanwhile, maybe it is on one side and the person can still bear the pain, then the person can get pregnant from the other ovary that is working. And so that is where the infertility comes in. But if it's like I have said, if it just affects one side and the other side is okay, the individual can still conceive normally. And if it is what is treated on time, the individual can still conceive.
Okay, but is it avoidable?
Well, the individual that will have it cannot be determined. They will have the risk factor for that one separately.
Okay.
But it's not like dysmenorrhea that, oh, the way dysmenorrhea can occur is not how the endometriosis can occur.
Okay.
But it can occur individual, though you have a iatrogenic because of the surgical procedure that the tissue is now implanted in an abnormal place, it can occur. While some people it comes spontaneously. But it's not, oh, when you do this one, you can prevent it. It can just occur spontaneously if it's going to occur. Not that, oh, is it because of this food I'm eating? Is it because of what I'm doing? Or is it because of my lifestyle that makes it to happen? No.
So does it have age limits? You know, the age that it can occur, or the age that it can stop occurring?
Well, as far as the individual is menstruating, that is when it can occur.
Okay.
And then when the menses stops, then it also stops too.
Oh, until menopause?
Yes. Or when it is treated.
Wow. Oh, so what kind of treatments can an individual get for it?
Yes, they have different treatment, but mostly, like I've said, if it's the one that is located in the ovary that is having the ovarian cyst, so they can remove it.
Okay.
They can remove it. But the individual that has been experiencing that and have been diagnosed of that, they need to see gynecologist for proper treatment.
Okay, so a surgery can do the work.
Yes.
What about medications?
Well, the medication can only suppress, reduce, but to remove it completely is surgery.
Wow. So that means every other person that think they've been treating with medication have probably just been using drugs to suppress, and at the end of the day almost abusing drugs.
Yes, yes. So that is why individual needs to know the cause of their menstrual pain. It is very important. What is causing the menstrual pain for A is different from B. So individual need to know. And once you know what is causing it, then you will know the treatment option. And once you have that complaint, you go to your doctor in the hospital so that they can examine you, they can do tests for you, and identify the cause so that they can give you the treatment option.
All right. A doctor once told me that waiting is healing. How long should one wait when they experience dysmenorrhea before they see a doctor for, proper examination?
Well, it depends on the pain threshold of individual.
Oh.
The individual that cannot tolerate pain at all, definitely individual will shout for help and go to the hospital for treatment. There's some individual, they can tolerate pains, they can endure for as long as they can endure, and then before they can complain. But anyway, individual that is having dysmenorrhea, if without any other associated thing, they may not come out on time. The individual that has been bearing pain and has issue, maybe for instance, is associated with prolonged menses, or for instance, the person couldn't get pregnant, so I'm sure such individual will go out on time, unlike somebody that didn't have those complaints. So it depends on the pain threshold of individual and other complaints, other experience of individual.
Okay, so just like you said that, for instance, an individual that cannot get pregnant, so it simply means that if somebody has dysmenorrhea, it's likely also going to affect, pregnancy intake.
It may, depends on the cause. For instance, if the person has the fibroid and is the one that is causing the dysmenorrhea, and this fibroid is located right inside the uterus, submucous fibroid. The fibroid is located right inside the uterus. That is the type that makes individual to bleed excessively. Some people can bleed for 5 days, 6 days, 7 days, 8 days.
Wow.
Because there is fibroid inside the endometrial cavity, submucous fibroid. So such individual, there is no how such individual will conceive. Because the place where the pregnancy is supposed to implant, that is where the fibroid is. And the person is having painful menses every month.
So you just mentioned, you said depends on individual threshold, threshold of pain, I beg your pardon. But I'm beginning to wonder, are there symptoms that are relative to underlying ailments?
Oh, thank you very much. Just like what I explained, if individual is having secondary amenorrhea and is due to uterine fibroid, so depends on the location of that fibroid. Mainly if the fibroid is located in the endometrial cavity, submucous fibroid. So there is no how such individual will conceive. That is where the pregnancy is supposed to stay, and the fibroid has occupied the space. So such individual will have infertility as part of the complaint. So the individual that is own cause is due to infection that's not properly treated, such individual will present with history of recurrent vaginal discharges, so which has to be treated. So some individual that, because they have a mass, maybe they have ovarian mass or any other mass in the pelvic region, such individual may present with abdominal swelling, depends on the size of the mass, or the mass may be big to compress on the excretory system. Now, they even make the individual to have urinary retention, that the person, the urine will accumulate in the bladder and the person will be urinating frequently. Or the individual may even have back pressure effect on the kidneys, that the kidney may not be working very well, can have symptoms of the kidney failure. The individual can present with that. So the other things that can happen that based on the cause, if individual is having I've told us about the fibroid, pelvic mass, and infection. So all this will be presented with signs and symptoms of infection, signs and symptoms of fibroid that can have prolonged menses, or the individual may be even having fertility problem because of the location of the fibroid. So these are the other things that can occur in association with dysmenorrhea due to the secondary cause.
All right, you also mentioned excessive bleeding. You now said up to 8 days. Some people find it very normal to have their menstrual cycle for up to 8 days. Is it abnormal to have that long length?
Yes, it is abnormal that The average day that people used to have menses is only 3 to 5 days. But some people who have menses for 6 days, 7 days, 8 days is abnormal, and it's usually a thing of concern and even making the individual to come to the hospital before we now detect other things causing that. So it's abnormal to have menses for that long. And some people, they, apart from having prolonged menses, they may even have heavy menses, whereby they use several pads during their menstrual flow. So it is abnormal.
Because I've seen a lot of my female friends that actually have their menses for up to 8 days, and they feel like if you have less than 3 or if you have about 3, it's abnormal. So people start telling you 8 days is a very long time. Then another thing that women do, I wanted to get your opinion on that, so we can, correct in case it is wrong. Some persons try to take some stimulants to actually help the menstrual flow come quicker, or rush, so that it doesn't speed into some other days, so they can actually have their time to do other things.
Well, any means of taking stimulants to bring about physiological process in the body has detrimental effects. And don't forget, there's no medication that didn't have side effects. No single medication. So using stimulants to shorten or to bring menses has adverse effects on the individual, which may affect the normal flow, the normal cycle of individual. And even the time, if the person is still within reproductive age group, the time the individual is supposed to conceive will not be determined because of the adjustment in the menstrual flow, which will also affect the ovulation period. So this has adverse effects. So such individuals should avoid doing that. They should plan themselves based on the physiological means of their body, or the normal time the flow is supposed to come, not them adjusting it. It's not good.
All right, and I think I was talking with a lady, and she was telling me that most caregivers actually tell their children that are actually experiencing dysmenorrhea that just boil up 1 or 2 things, some concoction, and they just ask them to take it as a pain reliever, and then at the end of the day it works. So I don't know if that is also medically accepted, that people should use other solutions that are unorthodox for treatment of dysmenorrhea.
Well, I don't know the content of such concussion, and this concussion might contain analgesic, pain relieving agent. Might contains that helps to reduce the pain. So I don't know the content. So the only thing for us to know is if we take the content to the lab and examine what is the chemical component.
Because my question was going to be that, are there unorthodox methods, for treatment of dysmenorrhea that people can actually engage in, not necessarily taking meds?
Those are the things I've just explained, like involved in exercise, doing yoga regularly.
Yes.
It helps. Or during that time, take as many times as possible hot bath. It helps. Use of the hot bottle placed on the tummy, it helps. Those are not medications. Those are the alternative means of treatment or prevention. Use of the hot towel placed on the tummy, so it helps.
Because I have to ask all of these questions because I've had a lot of asking of questions, and because I'm a woman too, so I have my share of experience. So a lady told me, no matter the level of hot water I put on my stomach, it doesn't work. Even if I put hot water bottle, the same person that takes up to 10 tablets of paracetamol.
Has it done any other things? For instance, massaging.
Okay.
Massaging the lower abdomen also helps for individual.
So
the intake, taking vitamin supplement, especially vitamin D, has he used that instead of taking analgesic that can affect our liver? So has not done that. Increasing the proteinous food or taking vegetables more.
Oh, you said small.
More.
Okay, more. Okay.
Taking vegetables more vegetables, more proteinous food. Has he done all those?
Okay.
This can work.
So that means during the period of your menstrual, during the length of your menstrual days, you have to watch what you eat as well.
Exactly. It's very important.
So watching the lifestyle during this period of time, is it
Very
before
important.
or only during?
Before, don't forget, one of the things I put as prevention is that taking balanced diet, doing exercises regularly, avoid sedentary lifestyle helps, because obesity is one of the things, is a risk factor for it. So you that used to that form of exercise, just that you take good food that contains important nutrients, proteins, it helps. So even when the pains will come, it will not be severe as it's supposed to be.
Oh, so that means the pain is avoidable.
Yes.
All right, thank you so much. I don't know if there are other aspects that I probably didn't ask you that you want to touch on.
Well, anyway, individual that might be having this experience over the time, you still need to see your gynecologist to really know the cause. Maybe secondary type, that the underlying cause can be treatable, that can be treated once and for all. And also, you can engage in all those preventive measures. You do exercise regularly, you take vitamin supplements, especially vitamin D, regularly, and then you make sure you take more proteinous food. So all this can help to reduce the pain.
Thank you so much, Dr. Akindokun, for your time. We really appreciate you.
Thank you.
Thanks for having us.
Thank you.
All right, viewers, that's where we end the show for today. Thank you so much for being a part of the show and for allowing us to also be a part of your lives. And I'll see you again next time. I am Olamide Al-Hassan. Bye for now.
Well, I'm Stella Izang. I'm a makeup artist. Yeah.
Hi, I'm Mojisola.
Yes, I do.
Yes, I have.
Well, I am experiencing it like every month, and it's not something that I will. It's not just funny at all. It's not just funny at all. The pain is just something else.
Yeah.
The pain is just something else. Yeah. It is.
Ah, of course I do. I actually envy those who don't experience menstrual pain, because for me it's always hell. So I do experience menstrual pain.
Well, yeah, I use Felvin, but it's not always. Like there's this month that it will come, and then the pain will be too much, unbearable for me. Then I have to get something to take. But sometimes I feel, let me just manage it.
Okay, so in my case, I don't usually take anything. You know, some other girls will take medicine to suppress their pain. I don't take anything. I just use hot water on my stomach or drink it.
Oh, well, it lasts for 5 days. Yeah, yes, 5 days.
2 to 3 days.
Wow.
Yes.
Wow.